Good morning to all. Myself T. Prabhu, Assistant Professor, SNS College of Pharmacy and Health Science, Coimbatore. Today we are discuss about case study of ectopic pregnancy. So, what is the ectopic pregnancy? An ectopic pregnancy occurs when a fertilized egg implants and grows outside of uterus. That is called ectopic pregnancy. Usually in a fallopian tube, this cannot be result in a viable pregnancy and can be life-threatening if not threatening properly. Common symptoms of abdominal pregnancy. Ectopic pregnancy, see the common symptoms are lower abdominal pain and uncontrolled vaginal bleeding and shoulder pain. These are the common symptoms of ectopic pregnancy. Then, what is the diagnosis of ectopic pregnancy? They may involve a combination of medical history, physical examination, and a diagnostic test. First one is medical history and physical examination. The doctor will ask about the symptoms and menstrual cycle and any risk factors. They will also perform a physical examination, include pelvic examination, to check for signs such as abdominal tenderness or abdominal masses. Blood test. A blood test to measure the level of hormone human chronic gonadotropin that can help to diagnose the ectopic pregnancy. In a normal pregnancy, HCG level is a typical double every 48 to 72 hours. The lower or slower than expected increases in HCG levels may indicate the ectopic pregnancy. Next, ultrasound. Transvaginal ultrasound is the most common image test used for the diagnosis of ectopic pregnancy. It allows the doctors to visualize the uterus, fallopian tubes, and ovaries to look for the signs such as empty uterus or an abdominal mass of fallopian tube or elsewhere. Other imaging tests. For other imaging tests is ultrasound, MRI, or rhodonocenosis to check the fluid in the space behind the vagina. May be used to aid the diagnosis, especially if transvaginal ultrasound results are inconsistent. Diagnostic laparoscopy. If other tests are inconclusive or if there is a high suspicion of ectopic pregnancy but has not been confirmed, the doctor may perform a diagnostic laparoscopy. This is minimally invasive surgical procedure involved in inserting a thin, flexible tube with a camera laparoscope through a small incision in the abdomen to directly visualize the reproductive organ. The early diagnosis of ectopic pregnancy is a crucial time to intervention and minimizing complication. If you suspect you may have ectopic pregnancy, seek medical attention properly. Next, what is the treatment of ectopic pregnancy? The ectopic pregnancy directed early to the fallopian tube has not ruptured. A medication is called methotrexate may be administered. The methotrexate stops growth of embryo and allows the body to reabsorb it over time. This is the treatment of typically effective of ectopic pregnancy. As small and level is relative low. Next, surgery. If the ectopic pregnancy progress or if there is a risk of rupture, surgery may be necessary. The common surgical approach of laparoscopic surgery, during which the ectopic pregnancy is remove the small incision in the abdomen. In the case of abdominal surgery, laparotomy may be needed, especially for the fallopian tube has ruptured or if there are any complications. So, expectation management. If some cases, particularly in ectopic pregnancy, small and HCG levels are low, the doctors may be recommended closely monitored and the situation without immediate intervention. This approach involves a regular blood test and ultrasounds exams to ensure the ectopic pregnancy resolve them. After the treatment of ectopic pregnancy, essential for the woman follow up with her healthcare provider and monitoring and supports. Depending upon the treatment approach and individual circumstance. Further fertility may be affected and counseling may be recommended to discuss the option for the conception of pregnancy planning. Thank you.